It's a relief for millions of people living with HIV after the U.S. approved an emergency humanitarian waiver, which will allow people to continue accessing HIV treatment funded by the U.S. across 55 countries worldwide. The decision means more than 20 million people living with HIV can continue to receive life-saving HIV medication during the assessment of the U.S. foreign policy. In the meantime, the government is assuring Kenyans currently on antiretroviral for HIV management that they will continue to receive their packages despite the U.S. freeze on funding on the same. The Director General for Health, Dr. Patrick Amoth, says the country has sufficient stock to last at least 6 months. We get more from our very own Brenda Wanga.
Of pardons and commutations relating to...
In the aftermath of the cut in funding of HIV-related programs by the USA government, the Kenyan government is assuaging the fears of nearly 1.3 million men, women and children currently on ARVs.
Our prescription pattern for antiretroviral therapy is that we give you 3 to 6 months of medicines. So nobody should be able to miss their medication despite what is happening out in the global arena. That is for us to be able to discuss as technical experts. Our role is to ensure that we shield the patient who requires treatment and ensure that they continue to receive the treatment.
The Ministry of Health, while acknowledging the impact of Donald Trump's actions, says it will not shy away from making adjustments to its budgetary plans to keep the programs affected going.
Sit down with the Treasury and make sure that we continue funding support to those patients who are receiving ARVs, those patients who are on malaria treatment. The nets we must continue distributing the nets. So it's just a question of now changing or adding additional resources through the National Treasury as opposed to where we're relying on the development partners.
The impact of the stoppage of the funding is only beginning to crystallize. According to the World Health Organization, the American government's actions has the potential to increase the risk of illness and death, as well as undermining the efforts to prevent transmission. WHO also warns that the funding cut could lead to a rise in new infections and deaths. PEPFAR had committed to fund its programs in Kenya from October last year to September this year to the tune of 43 billion shillings. AMFA, a HIV research organization, indicates that the funding cut will leave at least 17,229 Kenyans on ARVs at the risk of losing access to the life-saving medication per day. Of that number, 841 are children under the age of 15 who also need the medication on a daily basis. The funding cut will also have an impact on the over 270,000 healthcare providers who are directly supported by PEPFAR. And as the country begins to internalize the impact of the funding freeze, the former President Uhuru Kenyatta has advised African governments to strive for self-reliance.
I saw some people the other day crying, oh, I don't know, Trump has removed money. He said he's not giving us any more money. Watu wanalia. Why are you crying? It's not your government, it's not your country. He has no reason to give you anything. I mean, you don't pay taxes in America. He is appealing to his people. Shauri yenu bana. This is a wake-up call for you to say, okay, what are we going to do to help ourselves?
Kenya, like other African countries affected by President Donald Trump's executive order freezing the funding for HIV treatment and management, will have to look inwards to find ways of sustaining this life-saving treatment. Brenda Wanga, Citizen TV, Nairobi.